boom. Guess what? I did it all by myself. Anyway guys, a video on this hairstyle will be coming out soon. So in today's video, my forehead is saying good morning, hi, good afternoon. So welcome to the channel if you're new here. If you are not, thank you so much for coming back to watch my videos. My name is Nanu or Nankep. Okay, so in today's video guys, we are going to talk about medical school. I'm basically going to give you guys a summary of how my year has been and how third year of medical school abroad has been like for me this year, including Covina. Okay, and I'm just gonna grab myself up because I have the intro for this video, for the hair video that I need to film today, and I have 2 other videos I want to refilm because in those other videos the lighting was not great and I was not looking cute. I've already done my brows, as you can see. I'm gonna focus on my eyelids now. Very simple. I'm not even going to like stress about it. But I'm gonna give you guys an update or a summary of how my year has been like. On my year, honestly, I'm using my Revolution palette. My year, third year has how has third year been like? If I have to summarize it in like a couple of words, I would say third year has been relaxed and still it was relaxed, right? But before actually getting into third year guys, a lot of people, you know, seniors used to tell us that, oh, in third year don't worry, nothing is hard, you know, you can just relax in third year, there's not a lot of things, you know, you have to worry about. The biggest exam is like microbiology and pathology, but yeah, the biggest exam is actually pathology and microbiology. The rest you'll be okay, you know. So I went into third year thinking that, okay, I'm gonna ace this thing, like this year is gonna be my year to like literally do a lot of great things, pass my exam excellently and just chill and not stress about anything. Bear and behold guys, that was all a lie, because as soon as you get into third year you're like, oh my gosh, there's so much to do. And honestly, I wasn't ready for it because the seniors, all of them told us that, oh, don't worry about third year, you know, everything is chilled, relax. I was just like, oh my god, like you guys lied to us. And I'm not saying third year compared to second year, I would say third year the subjects are a little bit more demanding than the second year. Second year it was just biochemistry and anatomy that was like, and you know, and physiology that were like the biggest things. And I feel like in third year literally everything is important, of course, apart from hygiene, which was super annoying this year. Like hygiene was taking my whole year, like because we do so much in hygiene. You'd think you would do more in pathology and internal medicine than hygiene, but I felt like hygiene was super heavy. It was a heavy course. And guys, we had weekly tests every other week. We had semestral tests every other week, colloquium every other week. Like hygiene, just be ready for hygiene, okay, if you're not in third year yet. I'm just like, I wish someone had told me that as much as it's gonna be a bit relaxed, you still have to work hard. Like you're not just gonna relax, get me? But overall my third year honestly was a good year. I didn't have to retake anything this year, although there's 2 subjects that I did which I just passed them. And I just passed them, why? Because during the exam I was nervous, and I found out that I literally found out this year that I cannot be nervous during my exams. I have to do my best to be very confident. Even if I don't know the answer, I have to be confident in what I'm saying. And that's something I'm going to work on next year. Yep. That's definitely something I'm going to work on next year. And guys, I actually did enjoy my year. I actually did quite a few things, and I traveled a bit. I went to Veliko Tarnovo, I went to Sofia, I went to the UK, of course. I went home during the Christmas holiday. What else did I do? Yeah, and we hit 1,000 subscribers on YouTube. We got monetized on YouTube. Like I blew on TikTok. I guess that's an achievement. It's not like it's giving me anything. I'm not earning anything from it. Not everything is about money, yes. And I think TikTok has really been a platform where I'm learning to be childish. I'm learning to be to loosen up a bit and not think about life like, oh my god, I'm an adult, I can't do this, I can't do that. Like literally TikTok is that platform where I'm diverting. I'm so sorry guys, we're here to talk about third year, but I'm just giving you guys an overall, you know, summary of how my third year has been like. And TikTok has really helped me to just loosen up and be a child, to just be me again, like to not really care about what other people have to say about me or how I do my things or what I do in my life, including myself. Doing these things also, you know, helps me to be like, okay, you need to stop criticizing yourself, you need to stop not accepting yourself and believe that you are capable. But I do want to expand my social media platforms to, like, you know, see where I can go. I mean, anything is possible with social media these days as well, guys. And being a medical student at the moment and in the future a doctor, I love business. If you don't know, I am so into business. Like I have so many ideas I want to do, especially back in Africa. And I feel like having a social media presence is going to be good for me, because I'm gonna have, this is gonna help my brand in the future, you know what I mean? So yep, so that's literally what I was thinking about social media and everything. But yeah, my third year back again. In my third year, guys, as you can see, this video is not scripted. I did not plan it. I literally just thought as I was starting my makeup, let me actually give you guys an update about my life. But my third year literally has been really good. The subjects we had this year was pathology, general pathology, we had microbiology, we had pharmacology, we had hygiene, we had radiology, what else did we have? Internal medicine. Yeah, all of these subjects, which were very heavy subjects. It's not a joke. Overall, I learned so much about the human body, and I've seen patients, I've seen a couple of patients, seen a couple of cases. And guys, once you get in the hospital, you are gonna become a different person. Like once you go in to see, and you start seeing patients, in the hospital, you'll be like, wow, this is really what I got myself into. Because I feel like the first 2 years, right, you are just in your books and you're just in the seminar, you're not seeing patients, you're not seeing nothing, and you don't understand the depth of what you've gotten yourself into. Once you get to third year and you start going to the hospital, because at the beginning of the semester we did go to the hospital for like a couple of weeks because COVID cases were not that high. Looking for my concealer. So you'll be like, oh my god, I'm really a medical student, I'm really gonna be a doctor, I'm really going to treat people. I don't like really using the word treat, but I myself, like recently I've been thinking I want to be a healer instead of like to treat people. I feel like I want to be a healer, someone who heals people, like that heals different conditions, that gives hope to people. I want to be that type of person. And yeah guys, once you go to the hospital, you're gonna understand what you got yourself into. I mean, you do get it, like, oh yeah, I'm in medical school, yes, but once you start going to the hospital and you start seeing these sick patients, trust me, it's not easy. It's really not easy. You're just gonna be like, oh my god, people are suffering, and you are gonna start implementing some kind of thing in your life where you're like, okay, I need to look after myself. You're gonna be more thankful about your life, your health, overall, like your sanity. Honestly, you're going to appreciate life more. You're gonna appreciate that people around you are healthy. No one is, you know, in pain. You are really going to appreciate life more once you start your clinical years, and that's what I found myself doing. Also, guys, a couple of times this year, or towards the end of this 3rd year, I also got sick myself. And I had to go to the hospital. I had to be, you know, admitted at the hospital twice, and I got to see how it was to be a patient instead of someone that comes in the hospital, and instead of being a student that comes to the hospital and seeing sick patient, because I've really never been sick in my life until this year, and that really just opened my eyes to see how I should treat my patients when I'm a doctor, when I become a doctor, how I should treat my patients, what kind of questions I should be asking them, like the little questions as like, how are you doing today? Are you feeling better? How is your health overall? How is your stay in the hospital so far? Is there something we could do to, you know, accommodate you? I know as doctors we don't really have the time to do those sort of things, but I'm gonna try to incorporate little things when I'm a doctor to make that little difference that I can, because the medical world is not as they describe it to be, because when you're a patient, it's a completely different experience to when you are a patient. And I got to experience that this year, and it really just gave me a broader view of what medicine is. That's literally my summary of how my 3rd year has been like, and I really enjoyed this year. I've grown as an individual. I've discovered other things about myself. I'm still learning things, and, you know, unlearning some things I've, you know, believed for years. Like, there's just so much going on, and excuse me, I'm truly grateful. So guys, just be ready for 3rd year. I'm not saying 3rd year is hard. It's actually not hard. It's about discipline. Everything in medicine is literally about discipline. If you are a disciplined individual and you've set a specific time that, okay, I'm going to study this, and you actually stick to your plan, you are definitely going to be, you know, you're definitely going to make it. Honestly, I feel like in medical school, if you're disciplined, you have a bit of discipline in your life, things are going to be very easy for you, because you will be on top of your game. And this year I really did try to be on top of my game until I started slacking in the 2nd semester towards the end. But at the beginning I was so pumped up. Yeah, so yeah guys, so that's basically my life. 3rd year abroad has been good. Honestly, I can't complain. I finished 3rd year successfully, and I'm going to 4th year now. Like, that is crazy to me. Honestly, I find myself sometimes thinking, I just have one more year of studying, one more year after 4th year. And because my 6th year is basically my rotation year, where, you know, your internship year, I'm using my revolution to just contour. What? Can you see the contour? Oh my god, honestly, you don't even need like a buttery contour when you have this revolution glow bronzer. Yeah, this is so good. I'm so glad I bought it, because a lot of people were talking about this. Please let me know below how your year has been like. 3rd year has really been eye-opening for me. in terms of, you know, being a medical student and then thinking about, oh my gosh, I'm gonna be a doctor one day. And also my experience when I was sick, you know, as a patient, I just saw different things. I was just like, whoa. So yeah, I really did enjoy my 3rd year. I had good teachers this year. I really did enjoy it. It was really good. I'm super grateful to God for how far I've come in life, and for how resilient I am, and also for my hardworking abilities, and also for the fact that I'm a persistent individual. I don't really give up easily. I may doubt myself sometimes, but no, I really appreciate myself. I really love me. I love me, okay? It's important to sometimes tell yourself that, to recognize that you are, oops, excuse me, oh gosh, my eye. It's really important to just recognize sometimes that you are an amazing being by yourself. You don't need other people to tell you that you're amazing and you're flawless and you're beautiful and you're pretty. Like, I feel like it's important to realize those things yourself, and to also compliment yourself, and to always celebrate your wins, you know? Always celebrate the little wins that you have in life. No matter how small it is, celebrate it, because you really don't know what is gonna happen the next minute, okay? That was me this year. We're not even done with the year. Half of the beginning of the year, that was me basically. That's what I'm trying to say. I'm trying to make sure my brows don't get too oily. Girl, get it in there. Yes. Oh wow, this is so pretty. And blush up, because I feel like that shapes your face more. I'm just gonna line my under eye, my waterline. How your year has been like. Have you enjoyed yourself? What have you done? Let me know. That's basically all I have for you in this video. I hope you guys enjoyed it. I just need to do my lips and we are done. I like the look. It's very cute and just simple, nothing demanding. I love it. Anyway guys, thank you so much for watching today's video. If you enjoyed it, please don't forget to give it a thumbs up. Don't forget to also subscribe below, share the video, and I will definitely see you all in my next one. Bye guys.